Hi, thank you for inviting me here today. My name is Victoria Jones and I am the founder of the GOCreate Creativity and Arts programme that runs across Great Ormond Street. Great Ormond Street, I'll just give you a little bit of background, I'm sure most people have heard of us. It's inspirational and world-class care. We have over 200,000 patient visits to the hospital every year, and in everything that we do across the hospital we work very hard to live up to the core values of the organisation, which are pioneering, world-class and collaborative. Now, as a world-class hospital, we also aim to deliver a world-class patient experience, and within that I certainly aim to deliver a world-class arts programme. Oops, I got to remember to do the slides. I started the GOCreate Arts programme in 2005, and since then it's grown to become a very wide programme with a number of elements which now include a number of site-specific artworks, one of which is shown at the top left there. We have a growing art collection, we have an annual creative residency programme, we run regular creative workshops throughout the hospital, we also have a regular music and performance programme. Not to forget our staff, we have a cultural enrichment programme for our staff which is called Culture Club and involves all sorts of things. And we also have 2 changing exhibition spaces where we show different things, and then we also have a number of ad hoc projects which come up as and when. So GOCreate aims to make a vital contribution to the healing environment that we provide at GOSH. We basically, in a number of ways, aim to create relaxing, engaging and child-friendly environments. And the programme also aims to reflect the cultural diversity that we have at GOSH, and we also aim to be attractive to all age ranges, because obviously we're dealing with families, babies, right through to 18, 19-year-olds, so it can't just be all Disney and things for 5-year-olds. The creative residency strand of the programme is a project that happens once a year, and it allows us to work more intensively with a group of children or with a department. Now, when we run these projects we tend to work with a specific concern or need of a patient group or of a department. So we've done for instance, in X-ray department we did a photography project with a photographer whose specialism was X-ray photography. It's not brain surgery, obviously. And then we've done we've done all sorts of things actually with the creative residencies. This year we have magicians in residence, and we're working with Magic Circle magicians with children who have mental health problems and a lot of problems with their confidence. One of the magicians that we're working with, they've done this with other children, and one of the big benefits that came out of it was improved psychosocial skills, confidence, etc. We run across the trust lots of different one-off workshops as well, so these can happen over a number of days in different places, or they can just be drop-in some of the circulation areas throughout the trust. Again, as I said, we do something for all ages. Every year we have a fantastic film special effects expert who comes in and does hand and foot casting, and this is always popular. Everybody loves it because you get to take away your foot. It feels messy, but actually it's all hypoallergenic and all the rest of it, and you can see how young our participants are. We do all sorts of different art workshops. This is I love these 2 little boys. This was portrait bag making. This was taking place in outpatients, so where we have lots and lots of children coming through and completely various waiting times. Again, it's just something to completely immerse themselves in, and waiting doesn't have to become traumatic in itself. Down here we have obviously we have the link with Peter Pan, and we had every year we have Peter Pan Day, but we had a world record attempt. We attempted to break the world record for the a number of people in any one place dressed as one character, which sounds fun, but actually was incredibly complex because you have to adhere to all the Guinness Book of Records regulations, and all the outfits had to be a certain, you know, everybody's different, has different ideas about Peter Pan, but Disney have a very set vision. So we had, what we did was we had costume making workshops across the hospital, so that everybody, if they wanted to, everybody could actually make their costume, and then we all came together and we did break the world record, which was fantastic. And then again, this is workshops going on in the newly opened restaurant area of our latest clinical building. I mentioned that we have a fortnightly programme of visiting musicians. We also have one-off performances. We're very lucky because obviously we're based in London. We receive a number of offers from the Royal Ballet, which is, you see them there doing Peter Rabbit. This is Gandini Jugglers. This is an international juggling troupe who came in and did amazing things. A lot of these performances go on in main reception, or as I said, you know, circulation spaces. But with these jugglers, I actually persuaded intensive care and HDU to let me in, and they told me if it went wrong I would get the sack. I think I would have, but luckily they didn't. They've never dropped anything unless they do it for comic effect. At the bottom here we have couple of years now, at Christmas time, we've had a steel drum group come in who do calypso Christmas carols, which is just beautiful, but the reception staff hate it because it's very, very loud, and you can literally hear it throughout the hospital. We have changing exhibition spaces. This is a fantastic way to make connections with organisations from out with the hospital. What families tell me, and from what I know from, you know, working in a children's hospital, is when you are in hospital or you're involved in a hospital, you can feel quite isolated. It feels like, you know, it's overwhelming. So actually to have an exhibition space, if it's possible, although it's complicated obviously bringing things in from outside and infection control and fire, etc., but it allows us to bring the outside in and to make links with organisations or art galleries or museums. And so it just brings an added interest in for our kids. I mentioned that we do ad hoc projects, specialist ad hoc projects. A really good example of this would be the hands-on project, which ran for over 2 years with a fantastic artist who I adore called Isabel Manning. And Isabel devised the project to bring together art and science. And hands-on basically was a series of workshops and creative sessions. All sorts of different things were going on, actually looking and investigating why we should wash our hands, but doing it through art workshops and through creative means, and specifically looking at why in a hospital environment it is really important. And it was so much more effective than posters saying wash your hands, because everybody sees them and lots of people ignore them. And Isabel is a trained animator and illustrator, so together with the children she made this little film. I hope I've got time to show you this. It's quite short.
Microorganisms are everywhere. They actually are in our bodies.
If you even have just the tiny little cut, and the germs can still get in because they're so tiny.
There's lots of different types of them. You can't see them, but then they can see you.
There's good ones and bad ones, and you just have to make sure the bad ones don't affect you.
They mostly live in lots of places that are very muddy and yucky and gooey. Microorganisms are also in food, and they come out of your nose when you sneeze. So if you put it there and it starts to laugh, and then you know it is a bad germ. Like that. A coughing dog. There is about hundreds and hundreds and hundreds.
Some of these microorganisms
for ages, for 20, for about 3 days, and then they swap. It's a bit strange that. If you have dirty hands, you can easily tell it's dirty with like the stains on your hands.
The germs can spread really quickly. Washing your hands can stop that.
When I go to mosque, I have to wash my hands so I don't get no germs. What in my book?
If you do come into contact with some germs, it can build up your immune system.
In the olden time, they didn't have no soap, so they only used to just dip it in, put in water, then do like that, and then they wipe it off, and then they get that done. Then they get ill, and then they go to hospital, and then they get infection. Turn out.
So this film that the children made is shown across the hospital. We have these, I don't know if the AM screens that are across the hospital. Unfortunately, we don't have sound with those, but it is shown in other areas of the hospital as well. It's on our patient bedside entertainment system, and it's on our web pages. We are now beginning to seek funding to actually take this project a little bit further and to make a toolkit where basically taking all the work that was done and all the because there were scientists and lots of proper people as well as me and Isabel working on this. So what we want to do now is create a toolkit where play specialists or nursing staff or whoever might want to do it can actually repeat the activity, maybe not to the full extent that we did. It could be, the plan is to do it in sort of maybe 1 to 4 stages. So dependent on what resources are available within any given setting, they can not duplicate it but do something similar. We've just built a new clinical building, the Morgan Stanley Clinical Building. When we were building this building, we spoke with a lot of our families a lot of our families are with us for a very, very long time, and so can be with us over years. And one of the things that we heard again and again were that although these facilities were old and out of date and becoming beyond fit for purpose, people were actually very attached to these locations and to these settings, and families and staff as well weren't that keen about moving to this new clinical, very sparse environments, and some of them also, God forbid, were having to change their names, and this caused all manner of upset because people had been Ladybird for so long and they didn't want to become Koala, and there was lots of different things. But the name changes throughout this new building were all part of a wider wayfinding plan. And so what we had to do is we had to find a way to work with people to get them excited about their new names. So the new names in this new building are walrus, flamingo, koala, bear and eagle. And as you can see here, we developed graphic wallpapers that run throughout this building. Obviously from a wayfinding point of view, this helps areas to be easily identifiable. Unfortunately for some of our families, they may have to experience different departments within the hospital, so they might not just come to one. So it's important for people to be able to identify where they are and to make that visual link. Also some of our people, our families, English might not be their first language, so signage and identity become important. And what we did, I wanted to take it further than this because I always like to take things a little bit further, and we brought in a professional writer, and we asked her to work with children to develop stories about these animals. The writer's name was Sarah Butler, and she was absolutely fantastic. And what she did with the children was we did over many workshops and in lots of different ways developed a series of 6 stories with the children. There's 5 animals and there's a 6th story which intersects and brings all the different animals together in a story. The essential lesson is not to steal, it's all about a ring. You'll be able to find these books on our web pages. So the books then will live on the wards. They're published as proper books, and they also are on the patient bedside entertainment system. What I was quite shocked about was the Evening Standard in London has a campaign about literacy, and it highlighted how many people in London don't or can't read to their children. And I was quite shocked at this because I have 2 little boys at home, one's 5 and 3, and they just would not go to bed without a bedtime story, one each. It's the law and there's no escaping from that. So I was quite distressed that we had done all this amazing work with children and, you know, got them excited about writing and reading, and then they were going to have these books that they had been part of, but nobody was going to read them to them. So I came up with the idea to go to the charity, and I thought, well, quite a well-known hospital, we must surely be able to get somebody to read them. And I was delighted because actually we got 6 different people to read them, and so those narrated versions of those stories are available on the patient bedside entertainment system, so that if mum or dad can't read or don't want to read or are too tired to read, every child at Great Ormond Street can now have a choice of 6 bedtime stories. And what for me is really important is those are stories that were written actually by children, and they're very good stories because obviously they've had a writer who's brought them all together. But we were incredibly lucky. We had Serene McKellen, Helena Bonham Carter, Rhys Iffins, I'm trying to remember one, Sarah Milliken, the comedian, Peter Capaldi from The Thick of It. If anybody's ever watched that, you wouldn't imagine him reading bedtime stories. It was quite important for me that we got people from all around the UK, because although we're based in London, we don't just serve children from London, it's children from all over the UK. So it was quite important for us to get regional variety in those readings. Since we started the programme, we've been really fortunate to develop a number of really strong partnerships, which again I've found really useful. We did a fantastic project with Amnesty International. We've had partnerships with the Wellcome Trust and the British Library and the Tate and all sorts of different people. This here is Axel Scheffler, who drew the Gruffalo. He's the creator of the Gruffalo. When we did the project with Amnesty, they had commissioned a number of big children's illustrators to illustrate the Articles of Human Rights, which all is quite heavy stuff, but actually the drawings have been done in such a way that it's very child friendly, and it really conveys those messages really well to children. So we had an exhibition of each of those illustrations, and then within the exhibition space we were able to run workshops where children could come and take part and have a go. So you've got children there who are doing a shadow puppet workshop with Axel Scheffler. So this year, I'm really proud to say that we finally got there. I've been wanting to move the arts programme and the use of arts at Great Ormond Street into research for some time now, and with Faith's help, I was able to, well, we'd spoken a few times about it, and then the team came to me and they said, right, we've got an idea, and there was some funding that was available through the, I always get it wrong, Roald Dahl Marvellous Children's Charity. And so this year we will be embarking on our first clinical research project, which basically looks at how we can use the arts with children who have cancer and leukemia to explore the role of blood and to explore children's understanding of blood and how and why blood affects their condition, how blood will be taken, etc. Because as you know, blood is frequently taken from these children, and we don't know exactly how much children understand about this or how much they really get what's going on. So we're going to be working with a small group of children who are aged between 4 and 12. We'll be working again with the artist Isabel who did the animation, and the idea is to work with children again, so it's for children but by children, and we want to create a learning tool that will explain to children who don't take part in the project, it'll have a legacy. So what we'll create will then go on in a similar way to Janie's passport, will actually go on to help children who come through these departments and with these conditions in the future. Just a final thing, I'm really glad to say that in the 8.5 years since I've been working within the NHS, I came from an arts background prior to this, but in the 8.5 years that I've been working in arts and health, it is something that is gaining more recognition, and more health professionals understand the positive contribution that this can make to the patient experience. We've been really lucky with GOCreate that we've had in the last 2 years quite a lot of recognition. We received a special commendation from the Royal Society of Public Health for the contribution that we're making to the field of arts and health, and we were also cited. This is a European policy glossary document, and this publication was all about childhood, and from everything from healthcare through to social care, education, and they actually put a special section in that publication about the use of arts within healthcare, obviously looking at the concerns that children are often treated in a different way to how adults would be, and how are we communicating with them, how are we caring for them beyond just the medical stuff that's going on. So that's what I do. Thank you for having me.